Welcome to Moving Conversations, a podcast for movement professionals by movement professionals. If you coach, train, or teach movement, Pilates, or fitness, then this podcast is for you. With more than 60 years of experience in fitness and Pilates, your hosts, Brian Ritchie and Nora St. John, explore the science of human movement, diving deep into the facts, myths, and common misconceptions, hoping to spark thought and conversation about how we view fitness and movement. Now, let's jump into Moving Conversations. And welcome back to Moving Conversations. I'm Brian Ritchie. Joining me as always is Nora St. John. Morning, Nora. How you doing?
Very well, Brian. I have to say it is beautiful weather here, and I live in California. One of the wonderful things about the Sacramento Valley where I live is that the food is amazing. And I have a next door neighbor who has a peach tree.
Oh,
and she just brought me over this bag of like perfectly ripe peaches. And they are just the best peaches I have had in years. They're not rotten. Like usually peaches, you get them and they either never ripen or they rot. And it's a rare one that fits. It's ripe and it's ready and it's good. There usually doesn't happen that way. But every single one of these has been perfect. So I'm having a peachy summer.
Wow. Okay. That's one of my grapes and peaches are two of my biggest weaknesses for fruits. I literally lived on peaches and we had a tangerine tree down the street. One entire summer, that's pretty much all I ate during the day were those two fruits because I could get them and they weren't that expensive back then. You're right.
Yeah.
Now, hard to find ones that are just right. And you just have to sort of go with whatever they've got. And hopefully like a banana, you know, you buy them one day and they're green and wait 2 days and suddenly they're no longer any good. So you kind of have to time it just right.
Well,
and you do, it's wonderful.
I hope they ripen without rotting. Like sometimes they just go bad. They go from hard to bad. Like they don't even go through a moment of goodness in there. But again, she literally was across the street. She brought the bag. I'm like, oh, this look good. And then I opened up the bag and like
the smell.
That smell. Oh my God. Best thing ever.
Nice. Well, today we have a topic. Before we get to it, I want to remind you, please hit that like and subscribe button. We really appreciate it. Not only like and subscribe, I mean, about 35% of the people who listen to us regularly are actually subscribed. So do us a favor, hit the subscribe. It really helps. Really, really, really does help us out. If you see us on Instagram on Moving Convos, hit that like, repost, share. That way this gets out to more people. If you see it on Instagram under my name, Brian Ritchie, please do the same. We really appreciate it. We're getting a little bit more traction here and there. And after we're started our fourth year, we're really getting some decent traction. It's kind of nice and whatnot. So hopefully you guys have been doing your part and sharing and whatnot. And we really appreciate every single one of you. If you want to get in touch with us or have any topic suggestions, do it through email. movingconvos@gmail.com is the best way to get in touch with us. So today's topic. This came up this week because I think I mentioned before, a couple months ago, I had a surgical procedure. And guess what? I had another one on Monday. This one on my foot, infection, removed a big toenail. Horrible, horrible, horrible. Not going into details. That's really bad. But suffice it to say, I'm hobbling around, you know, one of my employees starts calling me tenderfoot. So I was like, yes, that's me. I'm tenderfoot today for a couple of weeks and whatnot. But the thought process was, okay, when do you start doing something? What recovery from illness, recovery from surgery, recovery from major surgery versus minor surgery, all of these type of things. When do you start working out again? When do you start moving again? What's appropriate? Because I don't know about you, Nora, but I've had a lot of people ask me, you know, I was sick all of last week. When is a good time?
Should I come in?
Should I come in?
Should I come in? Yeah. Yep.
You know, and, you know, same thing with surgery. I mean, I've had some people literally, I had this on Monday. They would have come in on Tuesday with an open wound and everything. And I'm thinking, what are you doing here? So I thought that'd be an interesting topic for us to discuss.
Especially because for you and I, It's not like we're training people for marathons. We're not
No.
assuming that they're going to have to run, 5 miles when the first day they come in. We have in our toolkit, and certainly in the Pilates Studio toolkit, and certainly in your personal training / Pilates Studio toolkit, you can start people anywhere, right? You can
Yep.
start people at any body part at any level. And
Yep.
one of the things that I always like to bring up, and this is an old study that I don't have the reference for, but I'll look it up if you need me to. They did a study with a bunch of young men. These were college age men. This was many years ago. And they basically put them to bed for 3 weeks. And the goal was to see how much deconditioning they happened in 3 weeks for these, again, 20 somethings or 18 to 22-year-olds. And they found out that with 3 weeks of bed rest, it took them a minimum of 3 months to return to their previous level of fitness.
Yeah.
Okay. So 1 week of not doing anything meant they needed really like 3 to 4 weeks of getting back to their regular activity level to return to their previous level of fitness.
Yep.
And they did the same thing with this group of people when they were in their, I think, late 40s, early 50s. I'm not sure how they got them back together again, but supposedly they did. And in that group, again, they put him to bed for 3 weeks, which is probably malpractice. I'm sure you can actually do that right now, but
I don't know if you do that
was
in
a
America,
bad
but
idea. That was a bad idea. And for many of them, they never returned to their previous level of fitness.
Yeah.
And if those who did, it took a year.
Yeah.
So, what that said to me at the time when I first heard this was many, many years ago. And again, even if this isn't, I think, well, it was based on an actual study, but it's also just what you experience. If you really don't do anything for a period of time, your conditioning can be severely affected by that. We're talking total bed rest. We're not talking like keeping some things going.
Right.
So when I think about recovery, and certainly at St. Francis, when I was working with all the sports medicine doctors there, and going to a lot of the conference I went to, they really took a very, I would almost say, aggressive approach.
Yeah.
And get something moving as soon as possible was kind of their basic mantra. If you had a knee surgery, move your other leg, move your core, move your arms, get some circulation going. All those things help with healing.
Mm-hmm. It's really difficult, I think, for a lot of people who go through things like this. And I'm going to use myself as an example. My surgery, and it was abdominal surgery, and it was pretty significant. And I had a lot of complications and pain afterward. And I wasn't able to do much of anything for almost a month.
Right.
By a month, I could barely walk a flight of stairs without being winded. And I could get on an elliptical for a half an hour without blinking at a high intensity level. And my heart rate didn't raise that much. 1 or 2 flights of stairs, and I'm just dying. And I thought, oh my gosh, you lose it so quickly. And it does take a while to come back, because once I realized that, I said, oh, I don't care how I feel. I got to at least get some movement going and start something. But as you know, sometimes when you feel awful, the last thing you really want to do is move. You just want to sit down and just be like, oh, woe is me. Because let's face it, pain makes you a little depressed, and you start feeling sorry for yourself. And depression leads to lack of movement and whatnot for a lot of people. And I was feeling that way. I'll be the first to admit it, man. I didn't want to do things. But you got to force yourself sometimes at a certain point, to at least get something going. Even after my foot, you'll appreciate this. I called leaving the hospital, called my wife, and just to let her know that I was thinking of stopping back at work, and I work a half an hour away, but I decided to come home. But I told her, I was thinking about going, and she said, if you say to the gym, I'm going to kill you. And I'm thinking, in the past, that is something that I can easily hear myself saying. It's like, but I can do other stuff, But I was like, no, I've decided I'm coming home for today. But then today I was stir crazy. So I had a little time. I went in the other room. I got on the spine fitter. I got on the foam roller. I did mobility work. I did a little bit of core work, whatever I could do just to get my body moving, because I felt sluggish. I felt like my body wasn't the way it should be. I still don't feel 100% in the rest of my body, but I feel better than I did.
And there's a bunch of things in that, right? So some of it is, and I've worked with so many clients with this transition from inactivity for whatever reason, post-surgical illness, whatever it is, back to activity. And there's the psychological component, which, as you said, is pretty profound. There's sort of the depression, the lack of motivation. There's also the fear. If somebody especially has something like a back problem or a neck problem, something very central in their body, their fear of movement can be we've talked about this before, but can be really profound. Yep. And many people's reaction to pain, whether it's, after surgery or after illness or whatever, is just, okay, I just won't do that. Like I'm just, I'm checking that off the list.
Yep.
And that's a really common reaction, which isn't always, I would say, is mostly not the right answer.
And we have so many people. I have a client who 15 years ago pulled a muscle in her back doing a rowing type exercise. She was working with a trainer who put way too much weight on a seated row machine and just kept yelling at her to keep going. And she pulled a muscle. She basically, I believe, pulled a rhomboid. She may have even, rotated a rib, but she had a lot of pain for a while. She still doesn't like doing rows. And what we do, I have to put half of the weight that she thinks she can do and slowly work up, because there's still that fear of that exercise equaled pain, and it's hard to convince your brain otherwise.
Yeah, exactly. I've had several clients I can think of with that same story. So one of the things that talk through a bunch of things. I've got a bunch of case studies and things with this. One thing that I start with, for example, is for all my women who are pregnant, right, and are having a baby, especially if it's their first baby. Many people say that, especially if you've had a C-section, that you want to kind of let the sutures heal, which is usually about a 6 to 8 week mark before you do anything particularly strenuous on the abdomen. Okay, so that makes sense. But what I've said to those women is that's great, or even just after the baby's born, if it's a vaginal delivery, is think about just some simple core work, like engage your transverse abdominis. Just pull it in and release and pull it in and release. Do some standing work. Do some, like if you're in the reformer, do some simple footwork. Do some feet-in straps. Maybe that can get a little tricky on the pelvis. Work. It's like there's always things you can do that for most people, most of the time, like you're experiencing this morning, will make you feel better. And again, it's like there's that activation energy. You don't want to do it, but once you do it, you feel better. And sometimes it's really convincing clients, like, I know you're going to hate this. You're going to not want to do this, but I promise you'll feel better after like 10 minutes. So let's just get over that hump and then go.
Yeah. There was always a philosophy that was put to me by a professor of mine that said, okay, you only have so much energy to live. And if your body is trying to recover from something, do you want to only give half of your energy to recovering from your injury and the other half to recovering from your workout or whatever else you're doing? Or do you want 100% to go to your recovery from the surgery or illness or whatever? And that was always something that sort of laid in the back of my mind. That I'm like, it makes some sense that, okay, I do want to recover as quickly as possible. I do want my body to heal. But I also believe that there's circulation that's going to occur when you do get your body in motion, and you can avoid the area. I don't have to use my right foot right now. I can do seated stuff. I can do lying down things. I can do all of that. So there was always that sort of mentality in my mind fighting, two sides of my brain saying, well, I still want people to recover, but movement is good and it's going to create better recovery and better healing.
Well, I think for me, the falsehood there is based on that previous study I talked about with, the young men, is rest is an interesting concept, right? We often think, and I think about one of my relatives' voice in my head, oh, honey, you work so hard, just sit down. Like it was always, every time to their house, oh, just sit down, relax, take the load off. Recover is kind of like the thing being that's a way to regain your energy. And you know, and I know that in fact, if I rest too much, my energy goes down.
Yes.
Right? Like particularly like that real rest, real like that whole idea that you only have X amount of energy. Actually that's yes, in some major way that may be true, but on any individual moment, right, I can build up my energy. Even at this point in my life, being an older person, like I can give myself more energy by doing stuff, or I
Yeah.
can give myself less energy by not doing anything.
Hmm.
So, really that equivalence is more like, how do you, and this is very individual, how do
Yes.
you keep, build your energy up, because your energy will also help your recovery without depleting you. And that's the funny line. Yeah.
Yep.
I think of many of my super type A, high achieving athletic clients. Their tendency in recovery was to do way too much and set themselves back.
Yes.
They come out of surgery. They're like, I'm great. I'm fine. I'm going to just go right back to my workout. And then 2 weeks later, they've actually re-injured the area or caused themselves more trouble. And then they really literally have to stop, right, for a
Yep.
period of time because they've just overdone things. That's one option. The other option is like, oh, I'll just wait until I feel 100% perfect. And then I'll go back to what I was doing. The problem with that is if you don't do anything, you may never get to 100% perfect because your body
Yeah.
needs circulation, needs energy, needs blood flow to heal. So it's a
Hmm.
fine lines there. There's a lot of balancing that we're trying to do there.
And it's hard to convince your client of that, especially if they've experienced, I don't know about you
Yeah.
but for me, I have a tendency when I get injured that I almost want to blast the area because I want it better now. I want to just get
Yeah.
this better. And I know what to do because this is our field. You know, my rotator cuff was flared up, 6, 8 months ago, a year ago, whatever it was. And it does take time to heal. But as soon as it would start feeling a little better, I would immediately start trying to do things that I know maybe I shouldn't, but I'm feeling better. I'm feeling good. So why not try it? And then it sets you back a little bit. But I'm
Hmm.
getting so bored
Yeah.
with those rehab exercises, and I think I'm a little better. But I also have to remind myself I'm not 25 anymore. So maybe my body does take a little bit longer, whether I like to admit it or not. Maybe it does take a little bit longer for that connective tissue to begin the healing process and for things to, fully recover. And sometimes it does require more time than I think an athlete or someone who has done athletics or dance or a high level of activity really wants to give themselves.
Yes.
You
In a
know what I
word,
mean? I mean,
yes. No, this is
our
this is this is
golfers, our
this is the
tennis players, I mean, they all
conundrum.
do it.
This is the
Yeah.
conundrum we come up to all the time. It's like a friend of mine has had some knee pain. Actually, one of my clients had some knee pain, and it is a fine line for them. Like I recognize. So first it was like, well, let's just rest it and see how we go. Things did not get better.
Yep.
Then they went on a bicycle trip with their husband. They hadn't really been biking much because their knee hurt, and they're like, okay, well, I'm going to join the crowd, and they did some biking. And after 2 days, their knee felt a whole lot better.
Mm-hmm.
But you couldn't guarantee that. Like it could have just caused more irritation, swelled everything up. There could have been a worse shape. And so it really is one of those things where every individual in every circumstance, kind of push it a bit, see how far you go. And then maybe you have to step back, but you have to find that
Mm-hmm.
line of how it's like, how is that path of recovery? Is it a slow path? Does it need a lot of rest breaks? Or can it be kind of more aggressive? Like you, Brian, I also like, oh, something's bothering me. I'm going to work it.
Yeah.
It's just like my knee hurts. Okay, I'm going to just do a bunch of quad sets. I'm going to do some squats. That's just my natural habit, which like
Mm-hmm.
you, sometimes is the right answer. Like oftentimes for me, more often than not, it has been the right answer, but occasionally it was the wrong answer. And I just needed to stop, but I didn't know that until I'd actually tried something and gone, oh, let's pull back. And I think that is the challenge with recovery from all
Mm-hmm.
of these situations is how do you figure out when to start, how much to start, and so much of our job is to monitor that. Yeah, so many of our clients, that's our job. It's like, okay, here's the red light, here's the green light. Let's push this. And then, okay, when am I going to push? I'm going to push you just a little bit this time. We'll see how you do. Right.
Yep.
Next day, day after, they come back in 4 days later, whatever it is. How'd you do? Okay, I was pretty good that night, a little sore the next day, pretty good by the day after. Okay, that's a little bit of a reaction, but I think we can continue with that level. Like we've moved it up a notch. Let's stick with that, see how we go. Then you take the next step up, right?
Mm-hmm.
And it's that slow, progressive feedback. Did it work? Did it not work? That just goes on and on.
And that's kind of what makes us sort of the body detectives that we are, is that we have to continually look at what seems to be working. I'm going through this with a client right now. She had some major, major problems for a long time. And we would try something and it wouldn't work. We'd try something, it wouldn't work, and it would set her back. And she took some time off because she went on vacation, did it, whatever. She was away for a good month. And she came back and I said, okay. I said, I think now's the time for us to start back on this. I said, but we're only going to do one thing. I want to limit the variables first. So it's sort of like, okay.
Agreed. Yeah.
One exercise, that's it. And on your own, you're going to do this no more than 2 other times this week. So 3 times in 7 days. And they say, oh, that's all, that's it. Because her body seemed to be very reactive to things that were happening when we were trying to push it a little bit. And she's someone who wants to push and wants to get better. So I said, okay, the next week, how did you feel afterward? Well, it was still a little painful. I said, was it worse? That was the key. Was it worse? Did it make it feel worse? No. All right. Good. You still do that exercise this week, but we're going to add one more thing in today.
Yeah.
And it was something simple. And again, each session we added one thing, or each week we added one more thing to the pile until they're doing more and more and more, and their body's able to tolerate it. I think with so many people who are just sick and tired of being hurt, I just want to do what I was doing and do what I want to do. And so they do too much, and then they get set back. Like I did with my shoulder. I felt great for the last 6 weeks. This feels great. And I do too much. And I go back to an old workout and think that felt great. And afterwards, I'm like, that was awesome. It didn't hurt when I did it. Fantastic. And the next day I'm like, holy crap. Well, what did I do? I feel beat up. And then it's another 3 to 4 weeks of nursing it. It's like, oh, okay. So there is that fine line. So I say limit the number of variables. That's sort of stage 1 for me, is limit the variables.
That's stage 1 for sure.
One thing at a time.
And then see how they respond.
Yes.
Right.
And you can do other parts of the body.
Absolutely. I mean, and that's the wonderful thing about what we do as opposed to what other practitioners get to do, is we can say, okay, we're going to just leave that ankle be. Right. For what or whatever. We're going to leave that shoulder be. We're going to work on your other side. We're going to work on your legs. We're going to work on your core, do all kinds of things that don't involve that area. So you're still getting circulation, you're still getting stuff, but you're not stressing that. So I think, and I think that's really a lot of our role, is exactly what you're talking about, is guiding them from one step, checking on that step. So, add a variable, see how they respond. If that was good, then add one more variable, see how they respond, and then slowly build them back up. And like you, personally, not just your clients, but like you, so many of us, and this is something I think about a lot, have the mentality of we are still our 20-something self or our 30-something self.
You're never going to convince me otherwise.
We are still that body that could recover within minutes and could do X workout, whatever it is, right? Like we're just who we are. That's our internal image of ourselves. It's always, I think, at least 20 years behind for most of us, 20 years behind where we actually are, 100%. Like 20 years younger than we actually are. And so there's that assumption too, like, well, I should just, I could just do this. And to put a finer point on what you were saying, it feels good at the time. A whole lot of, like, there's some things that hurt more when you work them. There are many things that hurt less when there's circulation and there's mobility and there's some of that stuff. A lot of times that decreases the pain. From a fascial perspective, you increase proprioception, you decrease nociception. So, there's that balance too. But it's what happens, like, again, on the drive home, that night, the next day. That's when you know whether they reacted or not. And so that's why, like, I take the feedback at the moment, but I don't get too excited about it, because it's easy as a beginning teacher to go, "Oh, you feel better. Great. Let's keep going." And you're like,
Ah,
"Okay, put the rakes on. That's enough. Move on to something else." How'd they do that night? How'd they do the next day? If that all went fine, do it again. If there was trouble, back it down one step. This is that delicate dance of recovery for
mhm.
everybody.
And that is something that we have to remind ourselves about. A lot of times just getting them to move. I have one
Mhm.
client that every time she leaves, and I do mean every time she leaves, I feel so much better than when I walked in. And she's pre-knee replacement, she's got a bunch of things that she's gonna have to deal with eventually in life. And she's in her early 60s. And but every time she leaves, she's thanking me like I performed a miracle. And sometimes you gotta take the ego out of it because it feels really good at the time. You're like, "Ah, ha, ha, I did my job." And I'm always like, "I'm so glad. I'm glad your body responded well." I'm not putting it on me. I'm putting it on their
Mm-mm.
body. They're the ones that actually
Exactly.
moved. I may have set them up right. I may have put them in the right position. I may have pointed them in the right direction, but it's their body that actually did the movement. And I wanna check in on them a day or 2 later and say, "How did it feel afterward?" "Oh, it's feeling better." "Fine." Or, "That night, it was kinda achy, but today it's not bad." I said, "Okay, so maybe we were a little aggressive, but if it's not bad the next day, maybe that is the level we can stay at." And we
Mhm.
can just see how their body responds. But I think a lot of it is take the feedback in, sort of listen to it critically,
Yeah.
let go of the flowers that
Yeah.
someone's trying to give you because everybody wants to praise us, and that's
Yeah.
wonderful. But put
Yep.
that aside, but listen to the other part and really try and figure out, okay, this hurt for 2 days afterward. Okay, that's a little too much.
Yep.
So what did I do? Okay, we're gonna do half of that
Yep.
and see how that worked. Or a third, whatever it is, whatever your number is, and you
Yep.
can figure it out based on
Yep.
the client in front of you, their age, their recovery, all of that. And we've worked with clients long enough that eventually you kind of figure out with a client, oh, this person recovers fairly quickly, or oh my gosh, it's been 9 months and they still haven't recovered yet. Holy macaroni. So sometimes it does take time, but when you get to know the client, you can figure that out sometimes, how much to push, how much to pull back.
And that is the story, right? That is absolutely the story there of how you moderate and
Mhm.
guide. You're really guiding your client from one state to another. And one
Yeah.
of the other things, this has been coming up a lot in some of the teaching I've been doing, the difference we talked a little bit about the other day, the difference between managing and healing.
Yeah.
And so many of us have little things that bother us, and they're not bad enough to stop us from doing much. A little low back pain in the morning, a little knee stiffness when we do this or that. So we just manage it. We don't really pay attention to it. We don't actually get in there and do the thing that might actually make it get all the way better. And so sometimes what I find with my clients with recovery is I'm working on that line. I'm really ideally in my idealized universe trying to aim them towards healing, towards full recovery of whatever that thing is. But you don't always get that, right? I'm sure any of you out there who are over the age of about 40 know that some things just kind of stay with you for periods of time, and then
Mhm.
you eventually resolve, but sometimes they don't. An old knee injury that just, like you had a meniscus tear when you were young and never really healed it and worked really hard on it. Maybe that knee will always be a little cranky, right? Like we've got those things, some of us. So some of it too is how do we just moderate and find get as good as we can, but also understand that sometimes you're managing the situation, right? Sometimes you're not going to get full recovery, uh,
Mhm.
and that client come to grips with a managed situation as opposed to full recovery can be challenging. And sometimes you're really working on, let's just take this one step at a time, see how far we can get. I
Mhm.
always say I maintain hope no matter what.
Mhm.
So no matter what that client comes in with or what their doctor has told them they can expect, I'm like, I'm not going to have, there's no ceiling in my mind. There's no end point that is
Yes.
predetermined for what we're working on. We're going to keep working and see where we go because I don't know, everybody's capable of amazing things. Yeah, some
Mhm.
clients, as you said, are really fast recovery. Some clients take forever, but I never say like, oh, you're done and this is over and, get used to it. I just don't ever say that.
And there's something to be said about just staying in motion as well and figuring out what doesn't hurt and doing that.
Yep.
Because even though my shoulder was hurt, I thought, okay, I can still do other things. My other arm works, my core works, my legs work, everything else was fine. So sometimes it's really about, okay, I need to strengthen that. And there have been a number of studies in physical therapy that actually show working the other body part causes strengthening on the injured one, even if the injured one isn't doing much. Instability, there's neurologic, there's a lot of factors. And I've read through some of the studies, and I'll be honest with you, it doesn't make sense if I'm doing external rotation exercises with my right arm, but my left one's hurting, why the left one gets benefit. I don't get it. I've read the studies, but it seems that there is something there neurologically that still creates some of those pathways to help it heal. And I think that that's sort of a fascinating thing as well, that we can say, look, there's so many other things we can do. And let's find those first. And we can, even if we have to let that rest for the next few weeks, we can still find all the other things that do work and don't hurt, and then begin to inch our way back.
So just to refine that a little bit more, like there was, one study where somebody was in, or they had a whole group of people that were in an arm cast, right? They like broke their femur or their humerus or their forearms or something. So they're in a cast. So that arm cannot move for usually 4 to 6 weeks or whatever the situation was. And they had them doing a full arm workout on the other arm. And so they did, 2 groups, one group that was doing the exercise, one group that wasn't. And they take the cast off, and the group that was doing the exercises, that arm that was in the cast had a whole lot more strength than the other arm. Yeah. Right. So that it was like that simple. So, and I tell that to clients all the time, and I use that, as a metaphor for them, or just as an example for them of, okay, well, your right leg's in a cast right now, or your right leg just had surgery and you're not supposed to do a lot of things. We're going to work the left leg. Now we're going to just make this a one leg thing, and we're going to get that as strong as we can, because that brain does mirror like what's happening on your right side. Your brain kind of thinks about happening on the left side, still sends the impulses to the muscle, still sends the motor control to the muscle. Like that whole reaction is still there, even if you can't actually move the thing. So that's a really important piece too, that we can always use in recovery, and I use all the time. Like, well, let's work the other part.
Yeah. And why not? If the other part works, keep it strong. Keep it strong as much as possible. Figure out what you can do and have your body do that, or your client's body do that. Now, I will say that depending on the injury, that can sometimes dictate recovery time. For instance, we've talked about tendonitis and tendinosis. Very different than a broken bone or a sprained ligament. Very different than a surgical procedure, where you have an open wound. You don't want to necessarily have them coming into a gym or an environment where they could get an infection and things like that. So there's always those variables in that aspect too, saying, okay, maybe you do need a little bit more time to heal if you have a tendonitis, because all you're going to do is upset the tendon. And maybe you need the anti-inflammatory, you need to see the physician or the physical therapist. So let's us work on everything else but that. It's not as clear cut as, let's say, a broken arm where the cast comes off and then it's like, okay, I can work this again. That seems pretty clear cut. Yeah.
The tissue hasn't necessarily been affected so much necessarily.
As much.
Yeah, exactly. And one of those things too that I always think about with both those circumstances is, how am I going to get that client to think more positively and to decrease the fear after an injury?
Yeah.
And what I find is fear is a profoundly brain dominating emotion. So, and I always think about something really simple and kind of banal. If you're walking around the city, and I'm sure some of the men have had this experience, I'm sure many of the women have had this experience, and you get a blister on in your heel, right? Or your toe or something, right? You got new shoes on, you're looking really hot, and you walk around, you're like, what is your brain doing with every step? Oh, my foot hurts. Oh, my foot hurts. Oh, my foot hurts. Like your whole brain gets obsessed and gets taken over by this blister on the bottom of your foot or whatever it is. And you realize like this is not a life-threatening situation. This is actually really insignificant in the bigger like
Mhm.
survival level thing, but your body responds like it's a major deal.
Mhm.
And I've had so many clients where they've got pain somewhere, again, in your case, left shoulder or their foot. They've got maybe a stress fracture in their one of their metatarsals or something. And basically their whole body's going, I'm in pain and I shouldn't move.
Mhm.
Right? Like that's just the natural habit of the body. And so much as the psychological is like, ouch, stop. It just
Mhm.
that's where we go. And instead, if I have a client like that and I really say, look, I understand that that's in pain and that's the loudest thing in your brain, but we're going to give your body the experience of moving other
Yeah.
parts. It's a distraction for one thing, which is pretty helpful for pain. And it's also helping them understand their body isn't broken. They've got things that
Mhm.
work fine. And there are ways that they can really focus on something else. And that's
Yep.
also part of recovery, right? Is understanding, well, what works? What can I do? And that often just reframing that to what can I do rather than what can't I do is helpful psychologically and physically and in terms of
I
program design.
absolutely. And I've told the story before and I'll bring it up here again. Got a client who is in pain all the time. But if she has a hangnail, it's the end of the world. She's on a 10 no matter when, no matter what happens, she's on a 10. And I have her do a simple exercise. And she'll, oh, everything hurts. I can barely move my leg. And I'll have her march and she'll start telling me a story and she's just talking away and she's marching. No problem. I didn't ask her how it feels. Because if I ask her how it
Mhm.
feels, oh, it's killing me. It's killing me. It's killing me. But as long as she's talking, I'm thinking, okay, how bad could it be killing you if you're maintaining a normal voice? You don't sound stressed in your voice. Your eyes aren't showing me signs of
Yeah.
fear and tension and pain. Then you're probably doing okay. And so sometimes you're right. It is all about distraction. It's just getting them to move and say, oh, this is going to be fine. This has nothing to do with that part. You know what I mean?
Yes.
I'll say something like that and they'll
Yes.
say, oh, okay, it might. Is it part of their
Right.
core? Yes. They might have a back thing. Okay. But I'll just say, nah, this is, you could do this in
We're
your
working
sleep.
something else. Yeah, working
We'll
something
get
else.
something
You're
else.
good. You're good.
And they'll be like,
Yeah.
oh, okay. And then they'll do it with no problem. But if you come at it with, now we're going to try this and we're going to see
Careful.
how
This
this
might
feels,
hurt. Yes.
we can create pain. I mean, for me, my thing with my toe, I wouldn't look. He gave me Novocaine. He numbed it. I refused to look because I know how strong the brain is, and I was
Mm.
afraid that I would try and create pain where may not be feeling it. If you're watching it,
Yes. Yes.
your body can
You're
think, "Oh my gosh,
reinforcing it.
that's
Oh
hurting.
my God,
That's
there's a needle
hurting."
going in. There's a needle going in. Right, right. Your body goes, "Rah, rah, rah." Yeah.
Exactly. And for the
Yeah.
things that did hurt, like putting the needle and the Novocaine, the anesthesia in, that hurt. But after that, it was sort of like, no, as long as I kept my eyes looking somewhere else, I was totally fine. Oftentimes I like to look because I like watching that kind of stuff.
We're
But when it's
curious.
me, I was like, I know my brain. I know I'm gonna imagine pain. So, and as soon as I took my brain and looked elsewhere, it wasn't that bad. And I've had to do that. I mean, we've all done it with dental. We
Yeah.
can't watch.
Right.
And you're gripping the chair tight and you're holding, and then they'll say, "Does anything hurt?" No. Then relax your face and your jaw. Oh yeah. You're just like, oh, I didn't even realize I was like this, tensing up the whole time. But we can imagine pain and we can create that. That sometimes just by distracting ourselves, by doing something else with the other arm, the other body part, or just getting them to move. Like I say, I did some stretching and mobility work. I knew it wasn't going to bother me. I knew it wouldn't, and it didn't. Was I pushing through my foot a little? Sure, but I just kept whatever hurt, don't do that. Okay, do this other thing. And we can almost always find something that the body can do.
Yeah, I've had several clients over the years who were really extreme, just clients in extreme pain of whatever kind, and they really genuinely were. And there was all the psychological stuff, but it was also just they were not going to be very comfortable doing a whole lot of things. And so we had a program which was, by all accounts, pretty minimal. Like you
Yep.
wouldn't, nobody would say they're getting a good workout out of this particular thing. But it gave them somewhere to come to. It gave them somewhere to go. It gave them some sense of hope.
Hmm.
And I mean, I think of one gal particularly. We would lie on the trap table and we would do arm work. And we'd basically do like supine arm work on the trap table with yellow springs or with therabands or something else,
Hmm.
just to get some movement going. Because any
Yeah.
movement of her spine really just hurt like heck. So we do a little bit of that. We'd find ways to do her leg work that involved nothing else moving. And we would just do that. And, it was challenging for me, for sure, because there
Hmm.
wasn't a lot of progress made, but she was able to maintain the life that she needed. She was able to do what she
Yeah.
needed to do professionally. She was able to kind of keep going. And it was a very minimal program, but something about just coming in, checking in with her body as often as she came to the clinic, to the studio, and then being able to move, getting some circulation, getting some awareness was just super helpful. Again, that was like
Hmm.
some of the more minimal programs I've ever done, but that was really beneficial for her. And I don't
Yeah.
know that anybody else would have offered that or been able to offer that.
And I bet you had to be very creative in
Oh,
what you
yeah.
came up with. I find that some of those clients, and I've had a number of them, and yes, you sort of find out these 10 exercises work, and that's all we're going to do for the next 6 months, probably, because if I go one step beyond, they're
Mhm.
gonna claim that I hurt them. So we're gonna do the same thing for a
Yep.
while. But
Yep.
I will say that sometimes those are the clients that I get the most creative with because I'll
Yeah.
think, man, all this other stuff seems to hurt. Let's try this instead. There's some stuff I've done on the foam roller for shoulder mobility work. And I'll be thinking, well, we've done it with a stick before. What if we added a band instead? What if we did this? What if we
Yeah.
did that? And
Yep.
we tried to have them move just in a little way. Or maybe I pull a little bit on the band and they're just holding it still, basically a statue type of thing. And they're like, "Oh, this feels okay. We found a path of we found, can you move in a circle? Can you move up? Can you move down? Can you do anything?" Yeah, okay, you write that down. Then we investigate. Next time we do maybe a little bit different. And I've come up with a lot of great exercises that I've used on hundreds of people afterward because it worked on them. And I'm thinking, I wonder who else it will work on. And you try it. I'm thinking, wow, this really works. I've got a frozen shoulder routine that I work with people. And when they first start, they're thinking, oh, I'm really limited. But after 6 or 8 weeks, they say, I'm really starting to see some improvement. It's very, very slow, but it's stuff that I had to sort of come up with because I'm thinking everything's hurting. We got to try something.
Yeah. Yeah.
And eventually you start finding these things that do work and then you try it with someone else. Does it work? Does it not? Maybe it was a unicorn and you just got lucky. That's possible.
That
But
happens.
sometimes you get lucky in the other way and you're like, "Oh wow, this really does seem to work. I found a pattern that does work." So it makes you very creative.
Absolutely. I mean, that's, I think, why, well, I know for me, that's a lot of why I work with the clients I work with and worked with all, was in the circumstances I was in, because it's much more interesting for me to have to do problem solving in,
Mhm.
in every session than to do the same old routine I've done, 800,000 times.
Mm.
That's just my particular nature. Yours too. I like to have
Yep.
something new to think on, some new food for my brain to go, how does that work?
Yeah, exactly. Exactly. One other thing I wanted to mention here, because and I said it in the intro, what about illness?
Hmm. Right, right,
Because
right.
cold and flu season comes around and they get sick. When do they come back? When is it okay? When should they? When shouldn't they? Because that's part of recovery as well. Have they
Yes.
recovered sufficiently? Because how many of us have had like, well, you're going to charge me, so I came in anyway, and they're hacking and they're spreading germs all over the place. It's
Right, you're
better
like,
since
"Go
COVID. I'll
home."
be honest. It's been a
Yeah.
little better since
Yeah.
COVID. They're at least respectful. But back then, I'm surprised I wasn't sick all winter because people were always coming in hacking. Oh, I'm not contagious. How do you know?
Right,
you know,
exactly. Exactly. Chances are you do not know.
you don't know. You just don't want
Are you a
to get,
microbiologist?
exactly.
Yeah, you
And
just
no
wanna
one
save some money.
And that's just it.
Yeah.
Nobody wants to be charged by canceling, an hour beforehand because they don't feel well, and I get that.
Right.
I
Yeah,
have a
yeah.
24-hour cancellation policy, most of us do.
Yeah.
But when, I've talked to a number of doctors and I've heard a number of different things. What's your sort of philosophy on this, and I'll share mine?
I mean, honestly, let's see. It, it's changed a lot. It changed a lot with COVID, I have to say.
Mm-hmm.
Um, and there's really two concerns. So one concern, to your point, is I want to be a little cautious with people coming into my studio and spreading a whole lot of germs. Again, if
Yes.
I have a lot of clients who are, or had, not at this, I'm not working with clients at the moment so much, but had clients who are older, who might be immune compromised. Like I've got
Mm-hmm.
clients who are vulnerable in
Number of
that
them.
sense. So
Yep.
I really, and I don't want to get sick either. So I'm often pretty cautious just on that front, that I don't necessarily want, rampant germs floating around my studio. There's only so much that sterilizing your equipment with a spray bottle is going to do, if somebody's coming in with something yucky. So there's that. Then
Mm-hmm.
the second thing is, I know for me, there are some situations, and I can kind of tell, where I can move just fine. Like I get allergies a lot of times in the spring.
Mm-hmm.
Allergy, like my nose is running, I may be coughing, I may be sneezing, but I know it's allergies. Like my energy
Mm-hmm.
is basically fine. I'm just full of snot. Right.
Yep.
And that's not contagious. And my energy is pretty much fine, and I can do pretty much everything. I
Yep.
don't have a fever, that kind of thing. Then having something more like a flu, either a stomach, well, two different examples. One is just like a fever kind of flu, maybe a lot of lung
Mm-hmm.
stuff. Those things that you really feel like you're going to bed. Like I'm
Mm-hmm.
going to bed. I have this thing and I am not moving. I want to stay on the couch. I want to read my book and I want to sleep.
Yep.
That's a different kind of illness for me. Yeah. And when I get those ones, a lot of times I don't necessarily want to be the first thing a client does in terms of physical activity. So I think my suggestion is often, well, if you feel like you can pretty much stay up all day, do your ordinary things around the house anyway, or go back to work, then you're fine to come in.
Good
If
rule.
you're like dragging out of bed, getting in the car, coming to see me, you're going to go back to bed when you're home, probably you shouldn't see me. Like that,
Yeah.
that for me seems like that's a good day to stay in bed.
Yeah.
So that would be kind of my take there. With something like a stomach flu, a lot of times there's just a lot of weakness that comes from that. And,
Mm-hmm.
so for that, it's like, well, as long as you don't feel like you're going to throw up on me or
Mm-hmm.
anything, I'm pretty good with having you come in and we can start to work and, and deal with stuff. So those are kind of three rough things. What have you got? I've probably got more, but those are three rough things.
You're right. They have changed since COVID. And like you, I do have a number of immune compromised clients. And during COVID, we really had to be very aware of who was in our studio. And someone would come in, and luckily we have multiple rooms. So if someone did come in and did have, something going on, I could put on a mask and take them in the other room and then sterilize the daylights out of that if I did know someone was immune compromised. And
Yeah.
I also have a rule that, look, if I send you home, that's the rule. You're not fit. I can see you are not well. You have to leave now. And I say, I'm not letting you get everybody in here sick.
Do you
And
charge them?
that depends on the client.
Okay.
I'll be the first to say, and I say that because we all have the person who is like, I don't know if I can come in today.
Right.
I don't know. So we know those who are like that. We also know those who never cancel,
Yes.
always show up, never. And they call you in the morning and say, you know what? I woke up and I've got this thing. Don't worry about it. I got you.
Exactly. Yeah.
Because
So the discretion of the owner, right?
Yeah,
Or whatever,
of
like those who
ex
never cancel unless like they're dying or their car broke down or something. It's like, okay,
Yep.
fine. I'll give you a pass on that. And then there's those who are like, oh, my hairdresser changed her appointment. I did have this happen the other day.
Oh,
I'm
yes.
like, so I need to cancel. And this was like 2 hours before their appointment. And I'm like, okay, I'm charging you for that one.
No question.
Right?
Yeah.
That is no excuse. Yeah.
Yeah, exactly. And when it comes to, I've talked to a number of physicians and I've gotten a consensus with this. So I've talked to a number of them. If it's the flu, you really want to make sure that they have completely recovered, that they no longer have a fever, that their energy level is like 85 to 90% back. Because if it's
Right.
only like 60% back, but they have no fever and they're feeling, they can sit down at home, do a little paperwork, and I feel fine, but they go to walk to the mailbox and back and, whoa, I can barely, I'm not 100,
Yeah.
I'm not there yet.
I'm a
Okay,
little
maybe it's
dizzy.
not
Yeah.
time yet. So wait until they're like 80, 85%, and then they're fine as long as they don't have, a fever or whatnot, or they're not showing symptoms. That's for something like the flu. Uh, when it comes to a cold, if you feel it starting, if you feel it coming on, so let's talk like a bell curve. The first, like 2/3 of a bell curve, the ramp up, the peak, and when it's starting to come back down, that's when you stay home. You do not want to be in the studio because I've heard that is technically when you're most contagious is at the beginning. When you still have that lingering something, like a lingering cough, you feel 100%, you're going to work, but you got a lingering cough, and we have some older clients, I'm sure you do. I have one, it's been 3 years, the cough has not gone away. She's seen
Yeah. I've
every
had several of
doctor you
them.
can imagine, and of course, someone hears them coughing now because, we experienced COVID, they're like, "Oh my gosh, they're sick," and I'm thinking, "No, no, no, trust me, they've been coughing for 3 years. It's
Right.
fine."
Right. It's
I'm
just
not
normal.
freaking
It's just,
out.
just their lungs are just not happy. It's just how it is.
Yes,
Yeah.
they're
Yeah.
irritated. It's just the way it's gonna
Yeah.
be for this person. So some people do have they're clearing their throat, they have allergies, they have something like that, but they feel fine. For that, I say, "Okay, you're good. You're good." But sometimes you can tell by looking at someone in their eyes, they're just not looking right, and
Hmm.
their energy is completely changed. I mean, your energy and my energy, even with allergies, it's still similar. We don't feel great. We're
Oh
hacking
yeah.
a little bit,
People
but
wouldn't generally know except that my eyes are red and my nose is running and I got a
yeah,
tissue like this, but otherwise I'm good.
exactly. You say, "Oh,
Yeah.
I just, I got
Yeah. Pardon
allergies," and
me.
it's
Yeah.
not a big deal. But when you can see they're white, ashen, they're they're just not looking healthy.
Hmm.
Like, you know what? You need to go home now,
Yeah.
and it's time. And a lot of I've had some clients say, "Okay, you're right," and they
Uh-huh.
know,
Right.
they
They're like,
feel it
thank you for
themselves.
telling me. Yeah. Cause I kind of needed somebody to give me permission in a way to just say, oh, I don't feel good. I'm going.
Exactly. I don't know
Yeah.
about you. I was the kid who cried wolf at school. I was bored. School bored the heck out of me.
I can imagine
I
that.
would finish the book and be thinking, "Okay, now we've got to still talk about this for the next 2 weeks." So I would literally be bored on my rear end.
Uh,
So if I wanted to go home, I'd fake sick. Now, when you do this when you're in 2nd and 3rd and 4th grade, your parents catch on to this pretty quickly. And from then on, I was never allowed to stay home. I was practically dying
Jeez.
before they'd let me stay home. So my brain literally to this day is don't be a faker, go.
Uh,
And then sometimes I'll ask my wife and I'll say, "I think I'm," and she goes, "No, you're staying home." And if she
uh-huh.
says that, I'm like, "Okay, you're right." Because
Uh-huh.
my brain is telling me, "Don't fake it. You can do it." And I'm sure there are times when, when you're a kid, you just don't wanna go to school, but there's other times when you could have easily, and you just didn't wanna do that test or whatever. But I think that gets programmed in our brain that we don't wanna wimp out, we don't wanna, not be there, or the boss is gonna get mad, whatever it is. And so you end up going when you probably shouldn't.
This is getting to a little. We've talked around this a little bit, but I just want to bring it up as kind of our last little bit here. So I spent a lot of time around little kids lately, just because I have a whole bunch of great nieces and nephews of all different ages, and it's just so interesting to watch their relationship to discomfort or injury. And I think this just completely plays into all this stuff because
Yeah.
I think of this one child that I think of particularly, who you would watch her fall down, and then she would look at her parents for their reaction. And if she got a reaction, then she'd start crying. Like it was that
Yep.
obvious, right? It was like and if the parent went, oh, you're like, oh, like if the parent reacted and they got the
Cry.
response from the parent, then they're like you literally saw them go, oh, now I should cry. Wah! it was just like, okay, that's really obvious. It was funny how obvious that was. And those are often, we see kind of a mature version of that same thing in some of our clients in terms of pain. That's just a little funny moment there. And then I have, a couple of other kids who are completely opposite. They are so, like they fall down, they rather seriously fall off their bike as a, 4-year-old and kind of scrape their knee and, bonk their elbow. And they kind of look at their parent. Their parent just looks at them like, how are you? You okay? They're like, and you see them kind of checking it out. Yeah, I'm okay. And then they go on. Right. So we learn that behavior so early, and how how people respond to us when we're in pain really creates a lot of that stoicness versus ooh, if I just cry, I can get out of this. Right. Or
Absolutely.
So I think that plays into all of this recovery bit as well as that part of the psychology.
Funny story. I don't know where I learned this from or if I just thought of this, but I taught my kids ta-da. So every time they fell, they would look at me and I'd go, ta-da. And I kid you not, after you do that a few times, they would fall down, hop up and go, ta-da, and then go about their business. They thought that's what you did.
They'd let it go. Yes.
And they kept going. They'd be in the park and other parents would say, what did he just do? And I say, he said, ta-da. And you could see they thought, how'd you train that? And I said, I just didn't necessarily want to reward them for crying. And in that sense, and maybe it's the Gen X in me, it's like, oh, toughen up. But, it was that part of me that's like, you stumbled. Yeah. Are you hurt? If you don't cry immediately and you look at me like, so it's kind of like, right. Just see. And it worked. And for the most part, my kids to this day, it's sort of like, they're pretty stoic when it comes to certain things. And sometimes I have to really poke at them and say, are you sure? And they say, well, yeah, it does really hurt. And I'm thinking, yeah, that's something we got to take a look at. So it can go the other way, but you're right. There are clients who sort of do this with pain to get attention.
Oh, yeah. Absolutely. Yeah.
And there's that negative attention as well as positive. And we have to respond with that as well and make sure that we give them the appropriate amount that they need, but don't necessarily reward them for constantly coming in every single time being in pain. You can reward them with, great conversation and here, we're going to get stronger and give them, reward basis on that. On don't you feel great? Look at this. You've never done this weight before. You've never lifted this much. You've never done those many reps. Your form was spectacular. Look at this. You're able to do this and you haven't ever done it before. That reward hopefully can bolster them just as much as getting the attention of some pain.
Oh, I'm so sorry. Oh my gosh. Exactly.
Yeah.
Well, so there's a lot of practical stuff in there. So hopefully you guys got something out of that in terms of creating a moderate program, responding appropriately to your clients, staying optimistic about what's possible, working the body parts that aren't injured.
Yep.
There's a lot of pieces in there in terms of just helping people recover. And a lot of good case studies too, I think, from both of us. So hopefully you guys can have some better results with your clients who are in recovery from something. And hopefully that'll help you out.
Yeah, I think there's a lot in there. So until next week, do us a favor, hit that like and subscribe button. We super appreciate every single one of you. If you want to get in touch with us, movingconvos@gmail.com. Check us out on Instagram, Moving Convos. My name, Brian Ritchie, under our YouTube channel. And for Nora St. John, I'm Brian Ritchie. We'll see y'all next week.
Bye, guys.